So a tummy tuck is a procedure that addresses loose skin, fat, and the muscles of the lower part of the abdomen. A tummy tuck is actually a little bit of a misnomer because we're really not tucking anything, we're removing skin and fat. So the real term for it is called an abdominoplasty. So an abdominoplasty is a procedure where you get a small cut, typically a small cut in a mini tummy tuck, in the lower part of the abdomen, typically very low, even below a C-section mark, where a bikini can easily cover it. Typically, we remove the tissue underneath the belly button, so all the tissue underneath the belly button gets discarded. It doesn't get tucked, it gets discarded. And once we get rid of that tissue, we're able to pull the rest of the tissue down to bring it down and make the lower part of the abdomen nice and tight. And that in turn makes the upper part of the abdomen tight. One of the most important part of a tummy tuck procedure is when on the inside of the abdomen, we're going to actually what's called plicate the muscles. We'll bring the muscles in together like an internal corset to tighten the abdominal wall and push everything back in. Typically, that is the damage that's done by the baby expanding the abdominal muscles, and now we're putting that all back together. Typically with a regular or a lateral tension abdominoplasty, which is a special abdominoplasty I do, we make a nice new belly button with a scar on the inside of the belly button, so the telltale signs of the tummy tuck is never found. That is on the inside and you never see that. The only scar that you really see is the lower part of the abdomen, and that scar over time will heal as well, and that scar is something that up until even 2 years after surgery remodels and gets better. There is also a mini tummy tuck procedure where everything that we just talked about happens, but the scar is typically half the size, and some patients are a candidate for that, and of course we would have to see you in consultation to give you precise advice about that. Thank you.